blockers. So last class we studied what ki there can be a few types. So some of them they were like nicotine, and nicotine was initially having a stimulatory effect and later on it was having a inhibitory effect. So you remember that, like what was the effect of nicotine on the low dose as well as on the high dose? Like low dose it was having different situation, then high dose it was having different situation. And like we discussed about this even atropine. Okay, and so over here if we talk about atropine, so atropine is the thing that we have been learning since the first, like early chapter also. It was a tertiary amine and all, we discussed that, na?
Yes, sir.
Okay, so now what we'll do is we'll talk about this ganglionic blockers. So if we talk about the ganglionic blockers, so what do I mean by this ganglionic blocker? So if I draw, let's say, so is this thing understandable to you, what I'm up to?
Yes, sir. Spinal cord.
Spinal cord. The spinal cord front side, anterior side, ventral side, that is what, motor or sensory?
স্যার সামনে দিয়ে গেলে তো ওই তো সামনে দিয়ে ইনফরমেশন সামনে দিয়ে মোটর যাচ্ছে,
Correct.
দিয়ে information আসছে।
তো তার মানে there is a nerve which is originating from here and this nerve is ending up over here. Like if I talk about, let's say this is from the lumbar region, so lumbosacral outflow, you remember sympathetic?
Yes, sir.
So there was this sympathetic chain ganglia and all.
Yes, sir.
So suppose this is one such ganglia which is entering into the sympathetic chain ganglia. This is a schematic diagram, of course. Now I make a craniosacral outflow. So this time I have got another outflow over here. Now you will notice that this is not going into any ganglia. Okay, this is not going into any ganglia. This is directly moving out. Why? Because it is parasympathetic. This is parasympathetic. And you will notice that for parasympathetic, it has its own ganglia. There is no chain ganglia in parasympathetic. It has its own ganglia. So we will see that in both the cases, like if it is sympathetic also, you will see that a post-synaptic, this is going to be the post-synaptic one, and this post-synaptic is going to reach, say, any organ, maybe heart. Okay, so it can reach any organ. Same way, if we talk about this parasympathetic one also, for parasympathetic also this has got its own postsynaptic neurotransmitter, and this will also reach. Say I am placing say same organ over here, the heart. Now what do we understand? We understand basic funda, that is in this area. That means what? Acha, okay, before that, one more thing is, this is a ganglia, this is also a ganglia. That means if we talk about ganglionic blocker, do you realize that it will attack these areas, they will block these areas?
Yes, sir.
Okay, so over here you will notice that what do they block? First of all, the presynaptic neurotransmitter, if you can recall, it is always acetylcholine. Whatever neurotransmitter is here, same neurotransmitter will be here also.
Yes, sir.
So that, yes, so this one is acetylcholine. That means ganglionic blockers, where do they act on? So remember, they act on the nicotinic receptors. Now question is there, are they acting on sympathetic or parasympathetic? So the answer is they acting on both. Okay, so is it a selective action or a non-selective action?
Sir, non-selective.
Correct. So this is the non-selective action. Now there are two ways in which it will work. So suppose this is one nerve ending, and let's say this is the postsynaptic part. Now over here, if you remember, there are present some ion channel. You remember there was this ion channel present over here. Now this ion channel had a nicotinic receptor. So this is the nicotinic receptor. So when acetylcholine is supposed to bind over here in this nicotinic receptor, then this ion channel will open, and when ion channel will open, the sodium and everything, they will be getting inside, causing depolarization over here. Now remember this. If I talk about nicotine, sutta. Okay, if I talk about nicotine, so nicotine has got a very weird way of action. What does nicotine do? Nicotine is going to open this channel up. Okay, because see, it is a nicotinic receptor. And of course you understand why it is a nicotinic receptor, because it definitely responds to nicotine. So since it responds to nicotine, so it is a nicotinic receptor. There is no if and but in this. So if you add nicotine over here, remember this channel will remain open. Always it will remain open. Mane, in simple language I can say that it will always depolarize. It will always depolarize this channel. Do you understand?
Yes, sir. Yes, sir.
Now remember, if this depolarization continues, then in the previous general pharmac chapter we have learned something, that there is a process called as desensitization. Do you remember? Desensitization.
Yes, sir. Desensitization.
Yes. So if you see, you are always opening this ion channel. That means what? You are overstimulating it. So if you are overstimulating it, so definitely, as our discussion went the last time, so there is going to be a desensitization going on. Understanding? So when there will be desensitization going on, so do you think there will be any further ion channel opening? No. So there will be no further ion channel opening. And if there is no further ion channel opening, then is this effect of acetylcholine coming up? No, the acetylcholine effect is not coming up. Got the point? So these is a weird kind of blocking. So if you are giving, suppose someday you are giving somebody nicotine, so are you experiencing, or should you experience the inhibitory effect directly? Definitely the answer is no. First you are going to get, so first you are going to get a stimulatory effect. Correct, huh? First you are going to get a stimulatory effect, then you are going to get an inhibitory effect.
Like ওই মানে বেশি পাওয়ার হয়ে গেলে পাওয়ারটা বের করতে পারে এরকম টাইপের একটা কিছু, লাইক নিজের অকাতের বাইরে টাইপের।
হ্যাঁ, so over here, that is why you will see that in case you are taking a decent amount of nicotine, then you will get lot of addictive effect. You will get some feel good factors, like you take nicotine, you feel hungry. You take nicotine, you feel focused. You take nicotine, you go to washroom, toilet and everything, your bowel movement goes absolutely fine. So if you take nicotine, everything is going absolutely brilliant. That's okay. But if you increase the dose, then after a while what will happen? This nicotine will not work. This amount of nicotine will definitely not work. So what will happen? You have to you will increase the dose, you will look for other fun factors and everything. So this is how the process goes on. So nicotine after a certain level is not going to be good, because there will be desensitization. So if nicotine initially, suppose you give, so initially it will open up the ion channel. So if it opens up the ion channels, maybe heart rate will increase, but after a while the heart rate will decrease also. So this is the weird part of nicotine. Hence I can say that nicotine is a depolarizing ganglionic blocker. Is a depolarizing ganglionic blocker?
হ্যাঁ স্যার
Yes. So now, except for nicotine, whatever we will talk about, they are all going to be non-depolarizing. Mane, they are simply blocking it. Look, there is a basic thing that you have to understand. Suppose there is a receptor. You are giving a drug which is going to open the channel. Now that drug is also binding to that receptor and opening the channel. So we say it is agonist. But the antagonist also needs to bind over here. But if it binds over here, it does not open the channel. Or I can say that it also prevents the others from opening the channel. Mane, it is more like what? More like a competitive inhibition. You remember in competitive inhibition, the ligand was actually binding with the enzyme. But it was of no use. It was not producing any product. So if it is not producing any sort of product, so it is also not allowing the other substrates to bind also. So definitely there will be no product. So rest of the drugs other than nicotine, they are basically the non-depolarizing drugs. So nicotine is a depolarizing blocker, and rest whatever I am going to discuss, they are all going to be the non-depolarizing blocker. And see, earlier we have discussed that there is ganglionic blocker, as well as we have discussed that there will be the neuromuscular blocker. So here in the third point, you see it is not effective as neuromuscular antagonist, because it doesn't work at the neuromuscular junction. Okay, in neuromuscular junction we have got separate neuromuscular blockers. Now normally
স্যার তাহলে ওই জন্য মানে যারা সিগারেট খায় তারা অ্যাক্টস অ্যাজ আ ল্যাক্সেটিভ,
যারা সিগারেট খায়
তারা মানে তাদেরকে ছাড়লে বলে যে তাদের ল্যাক্সেটিভের কাজ করে, এবং নিকোটিন মানে তারা যদি সিগারেট না খায় তাহলে নাকি তাদের মানে ক্ষতি হয় না।
Yes, correct. Definitely.
আচ্ছা,
Okay.
ওকে হ্যাঁ।
So we understand that, see, if it is a acetylcholine function, that means like in certain part, depending on which nicotinic, which area you are blocking, there will be either the sympathetic activity will be there, or there will be parasympathetic activity will be there. See, every viscera is under the control of autonomic nervous system. So like say heart, in the diagram we have heart. So if sympathetic works, heart rate will increase. If parasympathetic works, heart rate will decrease. So it all depends on if sympathetic, like what if. So it depends on what is actually triggering the heart. So sympathetic will increase, parasympathetic will decrease. But as a rule of thumb, everybody should understand that parasympathetic is the predominant tone. Okay, if you want to know कि अच्छा in resting condition, heart listens to sympathetic activity or parasympathetic activity, answer is parasympathetic activity. And it is obvious also, na, because we have learned what parasympathetic is more like rest and digest. Remember, rest and digest. So if parasympathetic is rest and digest, parasympathetic is all about rest and digest. So do you realize that in resting condition your heart will also try to be in the resting state, and if your heart really wants to be in the resting state, so it definitely needs a rest and digest phenomena. So that is why parasympathetic trigger, parasympathetic stimulus, that is always the predominant tone. Understood? So suppose if you give a ganglionic blocker to anyone, okay, so if you give a ganglionic blocker and in the gastrointestinal tract, so in the gastrointestinal tract, what will happen? What do you think will happen? Or suppose urinary bladder, do you remember that it is the urinary bladder or the gastrointestinal tract, they are triggered by the parasympathetic system. Do you remember? Rest and digest.
Yes, sir.
So if I give a blocker, do you think they will function, they will contract or do anything?
না স্যার, টেম্পারেচার কন্ট্রোল করবে। যদি নিকোটিন দিই তখন তাহলে প্রথমে আমাদের কন্ট্রাক্ট করতে হবে।
Correct. So that is why it is mentioned atony of bladder and GI tract. Once again, parasympathetic given to heart, it is lowering the heart rate. So if you are giving blocker, then it should
ব্লকার দিলে ওটা মানে ট্যাকিকার্ডিয়া হবে, মানে
correct. So that is why we have written here reflex tachycardia. Okay, Then in the same way there will be no secretion from the parotid gland, so xerostomia. Okay, so these are the things. Cycloplasia will take place. What is cycloplasia, by the way? Anybody knows?
সাইক্লোপ্লেজিয়া শুনেছি, নাম মুখে আছে।
Paralysis হয় স্যার চোখের মাসেলগুলো।
Come again, not audible.
It's a paralysis of the muscles in the eye.
Correct, muscles of the eye. Which muscle? There are so many muscles, na?
The ciliary muscles.
Yes. So it is a ciliary muscle paralysis. So what did we learn? If ciliary muscle would contract, then what will happen to the suspensory ligaments? Suspensory ligaments will relax. Do you know this?
আচ্ছা আচ্ছা
Are, wow, Devasmita is here. Devasmita, pleasant surprise. Wow.
না স্যার, ওই আমি বাইরে ছিলাম, মানে আছি এখনো, তো ভাবলাম এখন ফ্রি আছি তো এসে পড়ি আর কি।
Acha, good, good. So yes, we are discussing cycloplasia. So cycloplasia mane it is a paralysis of the ciliary muscle. So ciliary muscle, if do you remember the ciliary muscle activity, or should I explain?
আচ্ছা বলেছিলেন পুরোটা যেটা কন্ট্যাক্ট করছে।
হ্যাঁ, the ciliary muscle if contracts, তাহলে what will happen to the suspensory ligaments? Relax, yes. So if suspensory ligaments relax and ciliary muscles contract, then the lens is becoming more bulged or more thin.
বাল্জ হচ্ছে।
Correct, more bulged. That means now the person can see near object or distant object.
নিয়ে রাখছে।
Correct. So there will be near object. So the person will not be able to see the distant object, na. So there will be paralysis of accommodation. Okay, there will be paralysis of accommodation that occurs in the cycloplasia. Also, in the iris there are again two types of muscles present. So, like here we are talking about two types of things here in the eye. Like as far as the intraocular muscles are concerned, there are two things that one should know. One is, suppose this is the lens. So if this is the lens, then there is supposed to be these are supposed to be the ciliary muscles present over here. And if these are the ciliary muscles present, and suppose we are we are looking at it from the sort of the side view, so we will notice that there will be these kinds of suspensory ligaments which are present like this. Agreeing? So this is thing number one. Thing number two that we have to understand, that is, in front of it, once again there will be present another group of muscle. Now these group of muscles, they are more of circular kind.
So radial muscles.
No, these are called as the sphincter pupillae, and in between the sphincter pupillae there will be the radial muscles present. So remember that in case of this cycloplasia, there will be dilation of pupil also. So dilation of pupil means ek to too much light is coming, so you first of all cannot see properly. Secondly, your lens is bulged, means you cannot see distant things properly. So two big problems are here. Okay, because of these two big problems, cycloplasia is a problem. So that's why I have written about atony of bladder and GI tract, cycloplasia, xerostomia and tachycardia. So if you are using this nicotine, do you think you have any control on any particular part of your body?
না স্যার।
No. So that is why no therapeutic value. And action also, you have to understand the action thoroughly, because nicotine is going to act with, or it is going to mix with different molecule and behave differently. Okay, because ek to benefit to is not there, upar se there is going to be a lot of bad part, and also there is a problem. First the effect is going to be stimulatory, and then there will be paralysis. As far as the ganglia is concerned, first there will be stimulation, and then there will be paralysis. So how will you understand like what is going on? Like you have to be very careful while if you are giving this drug, you have to always stay with the patient, you have to stay with the object, subject, whatever, and you have to keep observing, because it is dose dependent. So with change of dose, effect can actually reverse. So and combination is also very important. Like suppose if I say there is an enhanced release of dopamine and norepinephrine. So dopamine plus norepinephrine, what it will do, it will cause pleasure as well as it will suppress the appetite. So you are getting both, because appetite suppression is a job of dopamine as well as norepinephrine.